Have you had long-standing lower back pain? Maybe you've tried other treatments such as physiotherapy, osteopathy, or even pain management. My name's Anthony Ghosh. I'm a consultant spinal neurosurgeon and founder of the Spine MDT. In this video, I'm going to discuss a new treatment called Basivertebral nerve ablation. I'm going to explain the rationale behind the procedure as well as how it's carried out. And if you wait till the end of the video, I'm going to give you my overall thoughts on the procedure. Some people with chronic lower back pain have Modic changes on their MRI scan. If we look at this scan here, here's the front of the spine and here's the back of the spine. These are the bones that make up the spine, and in between the bones we have these cushions known as the discs. At this level here we can see this bright stuff in the bone above and below, and that's what Modic changes are. It's believed to be a sign of chronic inflammation or overactive cells in the bone, possibly caused by a rupture and leakage of fluid, of inflammatory fluid, from the disc adjacent to the bone. Deep within the bone there is a nerve called the basivertebral nerve. This has nerve endings that are adjacent to the end plate where the Modic changes are, and they are stimulated, sending signals of pain to the brain. This is the same nerve that sends signals of pain to the brain when there's a fracture in the bone as well. So, basivertebral nerve ablation involves a very small nick in the skin. Under X-ray guidance, a wide needle is inserted into the affected bone, and then a probe is passed through that needle deep into the bone, which then burns away these nerve endings, or interrupting the signals of pain sent to the brain. This study compared two groups of patients with chronic lower back pain and Modic changes on their MRI scan. One group underwent the basivertebral nerve ablation, the other group underwent standard care, which includes physiotherapy or sometimes pain management as well. Then they looked at the outcomes of the two groups. The group that underwent the nerve ablation overall had better pain scores up to a year later, some even longer, and about 3/4 of those that underwent the nerve ablation overall reported a better quality of life. As a surgeon and clinician, it's important to look at new treatments critically. So here are some of my thoughts. Studies have shown that Modic changes are actually commonly seen even in people without back pain. So a good clinical assessment from a very experienced clinician is really important to determine if the findings of the scan actually match the type of pain patients are experiencing. A healthy disc itself doesn't actually have any nerve endings in it. In the case of a disc that tears frequently and generates local inflammation, we then stimulate the creation of new nerve endings into the disc. So sometimes the pain itself could be generated from within the disc itself and not necessarily the adjacent end plate. And that's why in my practice I like to target this area first with a nerve injection. Actually help me determine if the pain is generated from this area at all. Passing a needle into the bone is a minor violation of the bone. Now that's usually not a problem, but if you have a background of osteoporosis or osteopenia where the bone can be a bit brittle, it can then propagate a fracture and collapse of this bone. Also, care must be taken with X-ray guidance or image guidance to get the needle accurately into the bone, as you can also disrupt the facet joint at the back of the spine. The other problem with any form of nerve ablation is that nerve endings do eventually regenerate. So how long term is this procedure in terms of years? And this is why I like to work with partners of other disciplines of spine care, such as physiotherapists or osteopaths, for example, who follow up my patients and ensure that they are compliant with exercises, as well as lifestyle adaptations to help prevent the driving forces that cause recurrent disc tears and secondary inflammation. Overall, however, it is less invasive than surgery and therefore does carry less risk and has a quicker recovery time. So depending on individual circumstances, it may be something to consider prior to an operation. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel. Also visit us at spinemdt.com to see how we can help you. Thank you for watching.